roommate. आवाज करना है बस आवाज स्टूडेंट आवाज बंद है
अच्छा खबर बंद है लॉगिन थी
हां सर सब स्टूडेंट है ना ये स्टूडेंट है जो तरह ची दुकान अञा ईंदा सो असां नवे नवा 200 202 ई यूनिट स्टूडेंट्स पंज मिनट भले भले भले
मुझे साउंड कितना है
सर ही तव्हां जो म्यूट आहे
समय पे चाहिए सही है
फिलहाल
बिस्मिल्लाहिर्रहमानिर्रहीम Assalamu alaikum. This is Professor Dr. Qurban Rahu. I am Professor and Chairman of Cardiology Department. We started your cardiology, final cardiology lectures since last two lectures. Initial two lectures were supposed to be taken by me for consistent with this history taking and symptomatology and examination. But unfortunately, due to some busy schedules and meetings I was busy in the UC secretary for meetings, so I could not take your class. Dr. Jagdish replaced me. Now onwards, I will take your class for a few lectures, and then Dr. Jagdish and Dr. Anna will take your classes. So, previous lectures were included symptoms of cardiovascular disease, and then silent symptoms of the cardiovascular disease. Investigations were supposed to be covered in last lecture, but due to lengthy lecture, there was problem that Dr. Jagdish could not complete the investigations. So today I am discussing the investigations which are relevant to cardiac disease. So first of all, I will enumerate various list of the investigations that will this is the electrocardiography, exercise testing, and echocardiography, chest radiograph, Holter monitoring, nickel cardiology, cardiovascular magnetic resonance imaging and computer tomography, cardiac cath, which includes cardiac diagnostic cardiography and intravascular ultrasound imaging, and certain rare other tests which are sometimes needed for the making diagnosis of different cardiovascular diseases. So we will discuss each investigation one by one. So here comes first the electrocardiograph. Probably most of you have gone through the ECG paper, or you have seen the ECG pressings in family or some family member or some relative. So this is the typical 12 blade ECG taken from electrocardiography machine. You see, this is the various leads you can see on this radiographic paper. So you can see lead 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. So how these are taken? So this is a electrocardiographic machine. You can see this is the electrocardiographic machine, and there is a paper which is used for recording the ECG, and this is the format of limb leads, how they are taken. Some leads are attached with the limbs, upper and lower limbs, and there are certain leads which are used on the chest. So chest leads are sometimes called chest lead C1, C2, C3, C4, C5, 6, and sometimes they are called V1, V2, V3, V4, V5, 6. So any number you can find in different books, but most commonly used is the V1, V2, V3, V4, V5, V6. And distribution of these leads which are attached on the chest, you can see the V1 is attached just right of the sternum, and the V2 is attached just left of the sternum, and followed by the other leads going to the lateral to the left nipple. And these are the different names of the leads. This is lateral lead, and this is the lead 1, lead 2, lead 3. And this is augmented. A for augmented right ventricular lead, and the augmented lead left lead, and augmented inferior lead. And these are the chest lead V1, V2, V3, V4, V6. So these are the different cameras which are attached on the body to collect the different electrical signals that are generated by the myocardium, and these are recorded by the electrocardiographic machine, and then these are produced on the electrocardiographic paper, and from these there are various informations are taken. We will discuss ECG in detail while you will be posting in the cardiology department, and you will come across many ECGs. We will teach you and demonstrate you how to read an ECG, but to know little know how about the electrocardiography, this is just information. This is the just how this is the format of paper. You can see there are small boxes, and there is a large box, a circular large box over here, and there are small boxes. And there's a method that from if you measure the from vertical, so this is known as the vertical height. Sometimes it is known as the, you can see small box is 1 mm. So this is the measurement 1 mm. But the horizontal bar will show the time of this paper, and this will show the voltage of any electrical signal. How much any electrical signal or any event occurs, how much time it takes, that will be counted from here, this horizontal bar, and the electrical potential, the amplitude of the electrical wave, that is counted in millivolts. You can see this is the height of the millivolts. So typically, you all know that when there is a atrial contraction, this will be recorded on ECG as a P wave, and when there is ventricular depolarization, then the QRS complex will be produced on electrocardiography paper, and when heart is in depolarization phase, then you will have a P wave. These are the different waves and intervals. So this is the PR interval. PR interval is the start of the P wave and the start of the R wave. Now the PR interval, and this is the QRS complex is the Q wave. This is the R wave, and this is small tiny S wave. This comprises the QRS complex, and then this segment from the just when this wave S wave ends until the start of the T wave. This is the ST segment, and the this segment that is from the Q wave to the end of the T wave. This is known the Q interval. Each of these waves have their weight, specific width, and each wave have a specific amplitude by which, and each of the intervals have certain limits. By these, remembering these actual the width of the wave, amplitude of the wave, and width of the interval, we make diagnosis of different diseases, and we say this is a normal ECG, this is a normal ECG. There are so many abnormalities of the P wave, there are so many abnormalities of the QRS, there are so many abnormalities of the ST segment. Sometimes it is depressed, sometimes it is elevated, and T wave sometimes can be upright, sometimes can be downward, sometimes can be flat. These are the different information that we can get from the ECG. The ECG very much helpful in making the diagnosis of the cardiovascular disease, and especially ischemic heart disease. So this is just I talked to you that there are different P wave. This is the just the area occupied by the P wave, and this is the area occupied by the PR interval, and this is the area occupied by the QT interval. So by this is the QRS width of the QRS. So these are the different time. This is the 1.12 seconds, and this is the 0.2 seconds, and the QRS duration is 0.10 second, and QT interval is 0.42 seconds. So these are the different waves and segments which occupy certain space. We calculate them in a time interval fashion. And second most important investigation is the readily available at the hospital is the chest X-ray. You have heard that the chest X-ray may be very important in the respiratory diseases, but this is very important again as far as the cardiovascular diseases are concerned. You can see so in chest X-ray, there is a cardiac shadow, there is a lung fields, there is some skeleton. You can see the ribs and clavicles, mediastinum, and by knowing all these landmarks, you have a cardiac shadow in the central. So different borders of the cardiac shadow, you must be knowing that what is the left border. You can see that left border is formed by the aortic knuckle and then followed by the pulmonary artery, followed by left atrial appendage and the left ventricle. This is the formation of the left border of the heart. Any abnormality that arise from the aorta, pulmonary artery, left atrial appendage, or left ventricle can lead to distortion of this left border of the heart. And you can see on the right side, this is the right atrium, and this is the cephalus vein, this is the inferior cavity. So this is the border of the right border of the heart. So this is the superior border of the heart, this is the left border of the heart, this is the right border of the heart, and this is the inferior border of the heart. So this initial border, the one third of the inferior border on the left side is formed by the right ventricle, and the two-thirds of this border is formed by the left ventricle. So overall, sometimes there will be certain abnormality in the water. Sometimes there will be huge enlargement of the heart. Sometimes there can be a displacement of the heart on the right side. Sometimes there can be displacement of the heart schedule on the left side. By these abnormalities, we can make certain diagnosis of cardiovascular disease. And again, these are both PAV schedules. And this is the lateral schedule of the heart and lateral schedule. The RV comes in front and LV comes goes behind the behind towards the vertebral column. You can see the vertebral column over here on the posterior side and the sternum on the anterior side. So both the PA view and the lateral view are important in making any diagnosis of the cardiovascular disease. So the second most important test for cardiovascular test is the exercise tolerance test. You might be aware of this machine. This can be seen nowadays in most of the people who exercise in their homes. This is the typical treadmill machine. This is used for doing the conducting the exercise tolerance test. So you see this is the treadmill on which patient exercises, and during exercise, different leads like ECG, they are attached on the body of the patient, and blood pressure is being recorded simultaneously. And this whole image is taken on a computerized system, and finally, at the start, we take the different ECG recordings during exercise, and you can have a baseline ECG, and then we have a pre-exercise recovery period. So by conducting this test, we can diagnose the different diseases, especially ischemic heart disease. Suppose the patient has got a normal ECG, there's no change in the ST segment anywhere in the resting ECG, but patient when exercises, there is some ST depression. You can see this is the baseline. The ST segment is slightly displaced downwards. You can see over here the ST segment is displaced downwards. So by this recording, you can have recorded abnormal ECG during the exercise, because resting ECG is normal and exercise ECG is abnormal. So there are different parameters we'll discuss in detail whenever we will perform ETT in the ward. You will come in the ward, you will see how this test is conducted. But it's really informative, especially in patients who have ischemic heart disease, and those patients do not have ECG, resting ECG normal, but then your suspicion is very high that this patient has got ischemic heart disease. So you can put patient on exercise, you can record the ECG during exercise. This is how this exercise tolerance test is conducted. And this one test is known as the Holter, or you can say this is the ambulatory ECG recording, you can say. But this is the Holter testing, means that whenever patient is mobile, he is on his routine work, and the ECG, likewise, ECG is recorded when a patient comes to the ward. So this device is attached with the body of the patient, and different leads are placed on the chest and abdomen of the patient, and this device records ECG throughout his activities. So sometimes, depending upon the patient's symptoms, This ECG is recorded for 24 hours, sometimes 48 hours, and sometimes 72 hours, depending upon the patient's need of testing. So this test is very important when patient has got some arrhythmic problems, because arrhythmia is short-lived periods. Patient come in the ward and the clinics at that time patient may not be symptomatic, and when you record ECG at that time ECG will be totally normal, but still patient complains that he suffers some palpitation or slow heart rate or exaggerated heart rate while during the 2-3 times a day or in 2 days, single time in 2 days or single time in 1 day. In this way, this test is very much helpful in those patients who have got recurrent episodes of palpitation and you want to record what is the actual ECG rhythm during patient symptoms. What happens with patients during this test? He's mobile, he's working, he can go his office, but whenever he feels some symptoms, he has got diary with him and he records his symptoms. And ECG is, because ECG is continuous monitoring, there is continuous ECG is being recorded for 24 hours or 48 hours. Only the patient is needed to put a note in the diary while he is doing any activity. And finally, when this device is dismounted after the test is completed, whether this was 48 hours or 24 hours, then by computerized mechanism, you can have ECG tracings for all 24 hours and 48 hours. And finally, you have even graphical test available over there. You can read the ECG graphs over there, or there is summation of certain events that were recorded during the ECG. Patient may have atrial ectopy rates, patient may have small pauses, or small patient may have a loose block, third degree block, whatever the event is recorded in ECG, that is recorded graphically as well as in the graph. So you can interpret what is the problem with the test and the patient. And second test that is very important diagnosis tool in the diagnosis of cardiovascular disease is the echocardiography. You may have come across the patient with the reports of echocardiography, or you might have heard that patient goes under echocardiography. So this is basically just know-how of the echocardiography. This is the internal room where the echocardiography is being performed. You can see there is a monitor over there, and there is an echocardiographer who is performing the test, and there is a patient, and there is a small probe that is actually used as a camera to record from different sides of the patient's chest, from different windows. We call it echocardiographic windows. So from para-external or epigastral windows, you can have different images of the echocardiography. And now echocardiography is a very simple test. It's a non-invasive test. This is very helpful in diagnosing most of the disease, especially valvular disease, cardiac failure, and mitral heart disease. So this is very important test. There are different modes of echocardiography by which you make certain diagnosis in a particular patient. So echocardiogram basically is the application of the ultrasound, same as the ultrasound is being done, and we can evaluate the anatomy as well as physiology of the cardiac function. So there are different ways and, by which the echocardiography is performed, and there are different modalities of the echocardiography that are available for making diagnosis. So the commonest echocardiography method that is used for making the diagnosis most of the cardiac problems is the transthoracic echocardiography. Transthoracic is the word itself means where just I showed you in the previous figure that one person is recording echo from the thorax. So this is transthoracic. Sometimes when we have certain special problems, when we want to check the very delicate and minute problems in the heart, like especially in patient with the endocarditis. We have to see, look at the small vegetations, then we have to perform some transesophageal echocardiography. We put probe inside the, just like endoscope inside the esophagus, and from there we can get images from the esophagus as well as uh, from the stomach itself. So there are esophageal views and there are gastric views by which we can diagnose different diseases. And especially this transesophageal echocardiography is used in those patients who are planned for doing certain procedures, whether these are the percutaneous procedures like PTMC, or sometimes the patient can go uh, some surgical interventions. Sometimes this can be used during the procedure. Sometimes the surgeon is operating and we perform the echocardiography during the procedure. Even sometimes when patients are put on the PTMC table for the opening of the mitral valve percutaneously, then echocardiographer will help you in localizing the different devices, different valve at the particular place. So this is very useful, especially wherever there procedure is needed. But a common diagnostic tool, transthoracic echocardiography is sufficient. So these are the few modalities. You can see that there is a two-dimensional echocardiography, and you can have a M-mode echocardiography, you can have a Doppler echocardiography, and among dipolar, you have pulse wave Doppler, you have a continuous wave Doppler, and you have a color wave Doppler, you have a tissue Doppler, and more. So, and now the 3D echocardiography and 4D echocardiography. These are the just name I want to know, just to make you know that these are the terms that are being used in making the diagnosis at different times in different machines. So this is just for your information. These are different modes of echocardiography that are being used nowadays. In just in these diagrams I have shown you, this is the how the MO echocardiography is being used. So you see in mode echocardiography there is no structure visible. You can see only waves. So this only record the motion of the different structures of the myocardium or inside the myocardial valves. So this is not much informative. This is a very oldest method of recording the echocardiography, but it is again helpful in some. When you come to this image, you can see that certain structures can be seen. There are certain valves in this image, particularly this image is known as the peristernal view, and you can see this is the right ventricle, this is the intraventricular septum, and this is the left ventricular cavity, and this is the posterior valve. This shining structure is the pericardium, and this is the left ventricular outflow tract, and you got ascending aorta, and you have aortic valve over here in cross position, and you have a mitral valve in opening position, and there is a left atrium. So by in 2D echocardiography, you have certain structures visible. And whenever you apply Doppler echocardiography, you can see there Doppler, this is the color Doppler, you can see certain red and blue colors, and there is some mosaic, multicolored, something is present over here. So these are the different modes of echocardiography to diagnose different diseases. This will be discussed for detail for the, especially for those who are interested in echocardiography or for the postgraduate students. And this is the pulse wave Doppler signals. You see, there is no certain structure visible over here. They are just certain envelope produced. There is upward deflection, there is downward deflections. These are the different waves produced by the continuous wave Doppler echocardiography. By these waves, their information, their measurements, their amplitude, their width, we can make different diagnosis whether this patient is and suffer from any valvular disease or anything else. This is the signal produced by the pulse wave Doppler. You may not be understanding these things, but I will just informing you these are the different modes and things you remember. These are the different modes, these are the different names of the modes used to diagnose the different cardiovascular diseases. This is the typical image of the tissue Doppler echocardiography. This mode used in certain conditions in certain patients. You see, now certain diseases are diagnosed by the nuclear cardiography, or you can say the myocardial perfusion scans. So this is a very sophisticated test that cannot be performed in a cardiac ward or the clinical OPD like other tests, echocardiography, ECG, chest X-ray, and echocardiography, and these can be performed in the ward or clinical setting. But this need a huge camera like CT scanning, MRI, and you need certain isotopes so that can be injected into the patient, and then this isotope is taken by the heart, and then you can see the whether this is continuously or smoothly homogeneously distributed over the myocardial territories or not. So perfusion means whenever there is blood flow to certain myocardial area, suppose in this you can see the tracer which has been injected in the patient equally, almost equally distributed in the patients. You can see this is the short axis view, this is the longitudinal view, again this is the longitudinal view. You can see the whole myocardium is well perfused, means the isotope is taken whenever there is blood flow to the myocardium. Isotope through blood is taken by the myocardium. You can see on the graph that there is equal distribution of the myocardium, the isotope by the myocardium, for which you can see this is the normal uptake of isotope by the myocardium. That means that each segment of the myocardium is well perfused. But if you look at this side, you can see there are some defects over there. There's some gap in the perfume. So this is not well perfused. This is not well perfused. So we can be seen that this segment of myocardium is devoid of isotope. Means this segment of myocardium has not taken the isotope scan. That means that there is some reduced supply of the myocardium, of the blood supply to the myocardium. That is why there is some perfusion defect or perfusion defect, which is you see this not shining, and there is some gap in the perfusion of the myocardium, by which you can at least say that this is the defect in the myocardium, means that the left ventricular myocardium is not well perfused. There are certain segments of myocardium that are not well perfused, and when there is a no significant perfusion of myocardium, and myocardial perfusion depends upon the coronary blood flow. So by indirectly you can say that there is certain obstruction in the coronary blood flow, so that the myocardium is not perfumed. And by different territory, because you know coronary arteries are different coronary arteries. The right coronary artery, there is left coronary artery, and there are posterior descending artery. So whenever there is obstruction in the LAD territory, you can see that this area is supplied by LAD, this area is supplied by the inferior right coronary artery. If there has been some defect in the right coronary artery, this segment would have reduced supply. So by territorial, you can say that this region of myocardium is not well perfused. So you can conclude that this part of the myocardium, say about inferior wall, is not well perfused. That means the inferior wall is supplied by the right coronary artery. That means there is some problem with the right coronary artery. So by this, you can indirectly say that this patient is suffering from coronary artery disease. So this test is especially useful in those patients who have got coronary artery disease, or you can otherwise say that ischemic heart disease. It is the most common cause of myocardial diseases, cardiovascular diseases. So this is a very useful test for diagnostic the coronary artery disease. And yes, sir, now initially the cardiac imaging was not very common. Had the field in the radiology advanced, then initially the CT scan was purely used for the brain and other purposes, but now CT scan and MRI they are being widely used for diagnosing the cardiac problems. In these images, you can say you can clearly see where is the right atrium, where is the left atrium, where is the mitral valve, where is the left ventricle, where is the interventricular septum, and by this there would have been some breach in the interventricular septum that could be visualized over here. And if there is any problem with the aortic ascending aorta, aortic valve, it can be seen in this. If there is some problem in the right atrium, there's problem in the left ventricle. In this image, you can see there is some leakage of the regurgitation flow from the aorta into the left ventricle. In case of aortic regurgitation, you can see small regurgitant flow is seen in the left ventricle cavity patient with the aortic regurgitation. So these are the modalities which are now being used. Basically, not only the structural interpretation can be done from these cardiac imaging studies, but sometimes physiological studies can be done in while performing the imaging studies, because you can have a ejection fraction calculated in patient with the, while you are using MRI. So not only the structural interpretation can be done with the CT and MRI, but physiological interpretation of various diseases or various parameters can be done with the cardiac imaging like CT and MRI. You can see in this image very clear cut. This is the aorta and this is the arc of the aorta, and there is some cave after this left common carotid artery. So this is the typically seen in patient with the quotation of the aorta. Whenever there is a narrowing of the aorta, then you can diagnose it by the echocardiography. But sometimes, if you want to have more detail of the aortic segments, if you are planning for the any intervention or any surgery on these patients, then CT scan and MRI are very important. If this narrowing of the aorta can be seen in this image very clearly. So these are the modalities which are now being used, widely used in detecting various cardiac problems, especially structural heart diseases and diseases of the great vessels, like pulmonary artery, left ventricular appendage, any tumor. You can see the cardiac CT or MRI, especially in patients with left atrial myxoma. You can diagnose the left atrial myxoma on echocardiography as well as on the CT scan and MRI. And not only the inside structure of the LV cavity, the walls, but you can have a very good image of the coronary artery disease as well. Initially, only the coronary angiogram that was the invasive test that was performed during the cath lab, that is routinely normally known as the coronary angiography. But now, after advancement in the CT scan of the heart, you can see the coronary artery can be well studied in patient with the coronary disease by performing the cardiac CT. You can see this left hand coronary artery and this is the LAD. So you can have a good look of the coronary artery. You can see the narrowing in the segment of the coronary artery. So especially now this is known as the CT angio. Now sometimes we only perform CT angio not necessary that you have to take patient to the cardiac cath lab and do the invasive testing of coronary artery disease or coronary arteries, but by non-invasive testing by cardiovascular imaging by cardio CT, you can have a diagnosis of the coronary artery. You can see the course of the right coronary artery over here. You can see the course of the left circumference coronary artery over here. You can see the course of the initial segment of the left anterior descending artery. You can have a look at the left main coronary artery, whether this is narrow disease. So nowadays, this coronary CT imaged is a very important non-invasive diagnostic tool for the coronary artery disease. And there are certain other cardiac imaging studies. You see, these are the photos, images taken from the inside the coronary artery. So this is known as the IVUS, intravascular ultrasound. In this is an invasive test. This is not a CT scan like imaging an MRI. In this, the cardiac catheterization is very much needed. You take patient in the cardiac catheterization laboratory, and then you have to introduce the probe inside the coronary artery, and this will take the inside view of the different coronary artery in different segments. Means you can put this catheter in the left anterior descending artery from distal to mid and from proximal segment. All the whole of the length of the left anterior descending artery can be imaged by putting catheter into the left anterior descending artery. Because ultimately this is imaging test, that is why I put this in test in the imaging studies. Otherwise, this needs different left heart cardiac catheterization. It's very important. And this is a very new diagnostic test, and it's more sophisticated than intravascular imaging. And this is known as the cardiac OCT. In these, especially, you can see the stent that are placed inside the coronary artery, and you can see the intravascular thrombus inside the coronary artery. This is the more sophisticated, more advanced imaging tool recently developed over a few years, and it's very important, especially in those patients who are offered with liquid primary PCR, elective PCR. Whenever there is some coronary procedure, they will help in managing the patient with the angioplasty, especially if you want to see the immediate result of coronary study, whether the stent is well placed or not, is there any complication related to the angioplasty or not, that can be immediately seen in these tests. And then ultimately the cardiac catheterization, that is the invasive cardiac test. So again, there are certain patients who ultimately need invasive testing in form of cardiac catheterization. So we have got the left heart cardiac catheterization, we have got right heart cardiac catheterization. So these are the different catheters that are used during the coronary angiography. So this is the different shapes of the different cardiac catheters by which we can perform the left ventricular angiogram. This is the left ventricular angiogram. Here you can see there's catheter inside the left ventricle cavity, and dye is being injected into the left ventricular cavity, and the left ventricular cavity is being imaged, by which we can take information different. This is the inferior wall, this is the lateral wall of the left ventricle. So left ventricle can be viewed and its function can be assessed in this test. So this is the left ventricular angiogram. And when you want to perform the study in coronary arteries, then you have to perform the coronary angiogram. That means you have to put catheter inside the left main coronary artery, then you have to inject dye into the left hand coronary artery, and then the whole left coronary system will be perfused, and you can have a different segments of the arteries, left vein, circumflex, LAD, they can be visible, and you can make the diagnosis in different views. So this is how the left heart catheterization is done. And this is how you just taken this angiogram of the left system, that is the left main coronary. Similarly, catheters can be placed in the aorta. That is again the same left heart catheterization, and you can engage right coronary artery, and you can inject dye into the right coronary artery, and you can have a image of the right coronary artery. And by this, you can see that whether there is any disease in the right coronary artery or not. And left heart catheterization, that is, these are the diagnostic tests that can be performed sometimes. So you have to treat the patient's coronary artery. So whenever you find there is some very serious narrowing of the coronary artery that you want to open with the angioplasty, then you have to put advance your catheter inside the coronary artery lumen, and you can see this is the coronary artery. This is the coronary arteries image zoomed over here. You can see plaque that is obstructing the vessel, and the catheter is advanced inside the coronary artery, and a stent over the catheter is placed over here, and ultimately this catheter is balloon is inflated by this pushing the inflating the balloon. You are pushing the plaque to the side wall, and lumen that was narrowed is being opened. So again, this is the left heart catheterization, but the intervention is being done over here. Means you are putting catheter inside the coronary artery, you are putting balloon inside the coronary artery, you are putting a stent in the coronary artery. So whenever there is procedure, that means you are doing something in the coronary artery. That means coronary angioplasty is being done. So these are the interventional studies. So for left heart catheterization, there are diagnostic studies and there are interventional studies. The interventional procedures that are being carried out with left heart catheterization. Sometimes even when you want to assess some functional assessment of the coronary artery DN. Suppose patient has got a DN on the coronary artery, you want to see whether this is significant or this is not significant, then you have to uh, uh, something to do advance, that is the pressure studies in the coronary artery. So you have to advance a Doppler guide by across the knee, and you have to record the blood flow in the coronary artery. By that, you can assess the functional narrowing of the coronary artery. The narrowing that is actually obstructing the blood flow or not, that is being done by this coronary guide wire. So this again diagnostic tool that is very important when you plan for the coronary intervention. And then right heart cardiac catheterization means when you put the catheter inside the right side of the heart, because when you are performing the coronary angiogram, when you are performing the left ventricular angiogram, or when you are treating patient with the coronary disease, your catheter was in the aorta, that is the left side of the heart, and that is why it is called the left heart catheterization. And when you put the catheter inside the right ventricle structures like right RV or in the pulmonary artery, then this procedure is known as the right heart catheterization. So again, right heart catheterization can be diagnostic, it can be interventional. For diagnostic, you can have a catheter inside the right ventricle, and you can record different pressures and different saturation in the different segments of the right ventricle, right atrium, right ventricle, pulmonary artery, main pulmonary artery, or even branch of the pulmonary artery. So this is the whole study known as the right ventricular study and right ventricular cardiac catheterization. Sometimes some you have to do some procedures as well. Suppose a patient have got a pulmonary stenosis and you want to dilate it, you want to open it, and you have a balloon over there and you inflate the balloon. You can see this is a partial open balloon in the across the pulmonary wall, and this whole pulmonary wall is dilated by opening the full balloon. So again, likewise in the left heart cardiac catheterization and right heart cardiac catheterization, you have got diagnostic studies as well as you have got the interventional studies. Means you are performing the pulmonary wall flow, volume plastic over here, and you are recording certain pressures and saturations from the right heart pulmonary artery and the pulmonary wedge pressure and the saturation. So this is how the right heart catheterization is. There are certain routine tests that are performed in each disease, like blood CP, blood biochemistry, they are done. But cardiac enzymes are very important tests when you are making diagnosis of ischemic heart disease, especially acute myocardial infarction. We will discuss in detail in the segment of ischemic heart disease, but these are the different cardiac enzymes that are very important. You can the secretin kinase over here, you have got opponent T and you have got amino LDH and the amino transferases over there. These are different enzymes that appear at different time during the myocardial infarction, and they are removed from the blood at different timings. We will discuss in detail. So these are the different cardiac enzymes that are especially important when you are dealing with the ischemic heart disease, especially acute coronary syndrome, or you can say that during acute myocardial infarction. And then certain rare tests, but they are very significant tests. You can have electrophysiological studies by which these are the studies that are conducted in patients who have got arrhythmic problems. People who present with different tachyarrhythmias, they are being studied. You are putting various catheters inside the heart, in the RV, in the RA, in the coronary sinus, and record with different ECGs and perform the studies. So these are the different graphs that are being recorded from the catheters. This is the EP study. This is being done in the cardiac cath lab, and this is the tilt table testing. This is very important when you are working on a patient who has got complaining of vertigo or syncope. This is very important. Sometimes, very rarely, cardiac biopsy is performed in making some diagnosis of the rare cardiac diseases. So cardiac biopsy can be a test in certain patients. So these are the various cardiac vascular investigation that you come across while you are treating a patient with the cardiac problem. So any pair of patient who comes with the certain problem, present with certain symptoms, you see certain signs and then you make your confirm your diagnosis through your investigations. So these are the tests we will discuss when we will be dealing with each disease. Then, because the importance of each test is important when you are dealing with that patient. Suppose ischemic heart disease, the cardiac troponins and ECG are very important when you are dealing with the syncope and palpitation. Then AP study and tilt table testing is important. And when you are dealing with valvular disease, structural disease, and bilateral disease, then echocardiography and the CT and MI are important. So this is just a know-how about the cardiac investigations. Now we will take you for a question session. Uh,